Empower.
Ban over Omicron cases when the country officially did not record a single case of the variant locally was taken following the decision of Switzerland to place 5 countries including Egypt on its 10-day quarantine list and oblige travelers from those countries to present negative PCR tests.
To shed more light on that, we are very much delighted to be joined over the phone by Dr. Salah Abdallah, our health expert. Dr. Abdallah, good afternoon to you.
Hello, good afternoon.
Good afternoon to you, Dr. Abdallah. Sir, what are your expectations for developments pertaining from the spread of the Omicron variant?
Well, you know, the new virus or the changed virus or the changes which happen in the virus, you know, is increasing the afraid around the world. Many countries now is afraid. You know, it had been changed in South Africa and spread in South Africa, but not in all Africa.
Yeah.
But, you know, some European countries is looking for Africa as a whole, and they have a kind of phobia. Like what happened, you know, from Canada,
Yes.
which prevent, you know, the passengers from Egypt and other African countries.
Yes.
This is a kind of phobia because Egypt not yet have these changes in the virus.
Yep.
And there is no proof that the virus reaching Egypt up till now, maybe up till yesterday at least.
Yes.
So there is a case of phobia in the world, afraid from these changes which happen in the virus, which make it spread more. Although the test cases is too low, but of course the spread is too much. That's why you there is or afraid more than the reality.
Yes. Sir, how do you see here Canada's decision to lift the travel ban on Egypt and the other African states, the 9 other African states? How do you see Canada's decision, Dr. Abdallah, to lift the travel ban which was imposed on Egypt and other 9 African states?
As I said now, what Canada is doing is a kind of phobia, especially towards Egypt. Virus spread in South Africa, and South Africa is in the south, Egypt in the north. The distance too far. They have a phobia of afraiding from the virus. So the decision is not correct, you know, in my opinion, is not correct, especially towards Egypt, because not yet that now, not Canada alone, the European countries also have the same phobia.
Yes, yes. But how do you see the decision here that Canada decided to end this Egypt or this ban on 9 African states?
This will take time and by time they will take again and they will return things from from other countries. It will take some time before returning to normal, and because we proved where is the maximum increase of the virus. You know it. For returning.
Sir, I kindly mentioned that there's some phobia here from Omicron. Symptoms are not very severe here. How do you see this phobias by many countries?
Can you repeat the question, please?
Yes, the severity of the Omicron is not as severe as the Delta, for example. Why this phobia here?
The severity of the disease,
Yes.
you know, is the rapid spread.
Yes.
You know, this virus, this change virus now, it has some character. The spread is very
Yes.
the virus before. But if you observe, the number of deaths is less.
Yes.
This means that the virus is weaker than before.
Yes.
But it's rapidly spread. And of course, it reaches some of the European countries from the people who are visiting South Africa.
Yes.
But it's not spread in all Africa. You know, many African countries, the virus doesn't reach the African countries.
Yes.
It is directly through the tourists who are visiting South Africa to Europe directly.
Yes. Sir, how would you describe here Egypt's support for the African states during the coronavirus pandemic?
Of course, Egypt is doing their own best to support other African countries.
Indeed.
And this appears in many steps. Number one, now Egypt is producing the vaccine for the virus.
Yes.
And of course, part of the manufactured vaccines will be directed to the African countries.
Yes.
This is number one. Number two, Egypt is sending many health equipment to the African countries who are in need for equipment,
Yes.
who are lacking in the equipment due to their own economic situation.
Yes.
Like South Sudan, like many other countries, you know, Egypt is sending the many health equipment for them.
Yes.
This is number two.
Yes.
Number three, there is, you know, cooperation in the question of information about the number of cases and the spread of cases
Yes.
and the direction of the disease between Egypt and the other African countries. Of course, some doctors now they visit the African to help in guiding or giving direction or looking to the situation in this country and support by doing the health organizations in this country.
Yes.
So Egypt is working with the African countries
Indeed.
continuously for stopping this virus or fighting against this virus and for decreasing the effect of this virus.
Sir, what challenges face Africa during the pandemic from your point of view, Dr. Abdallah?
This endemic disease or of fear or situation. That's why you are working together in many projects to create a situation to face this crisis. From the health point of view, as I said, there is a cooperation in the information with countries all. Secondly, there is some countries which is more like a joint project, especially in question of the food which is necessary for the people, you know, because if this crisis continues for a long time, there will be a serious economic effect. It can reach the level of people will be hungry. So now, you know, some of the African countries now are working together, and Egypt, one of the most countries who are looking now to have joint projects with other countries, especially in the question of farming and agriculture and many aspects to help the economy of the country to until this crisis is finished.
Yes, indeed.
So, of course, the fear from this crisis makes the African countries more or cooperating together.
Yes, indeed. Dr. Salah, thank you for your precious input. And we are having now this report where South Africa said vaccine and prior infection help for the mildness of the COVID cases. More details.
In early December, Switzerland removed Egypt from the list. The World Health Organization, WHO, has called for countries to keep calm and take rational, proportional risk reduction measures in response to the new fast-spreading variant. The Egyptian Health Ministry announced on Friday that it recorded its first cases for travelers who returned back to the country and were discovered at Cairo International Airport. 3 patients are currently in Cairo Hospital. South Africa's health minister said on Friday that the government believed that vaccines at high level of prior COVID-19 infection were helping to keep disease milder in a wave driven by the Omicron variant. There have been early anecdotal accounts suggesting that the it is too early to draw firm conclusions. The country reported a record number of daily infections earlier this week. South Africa has given 44% of its adult